Follicular unit transplantation is the current technique used in modern hand transplantation. Basically what it means is that we remove follicular units from the back of the head and transplant them into the area of baldness. Follicular unit is basically a structure of the skin that is composed of 1, 2, 3 or even 4 hair follicles. There are different ways of removing or harvesting the follicular units from the donor area. There are 2 ways. One is called FUT or a strip harvesting technique, and the other one is called FUE or follicular unit extraction. The FUT or strip harvesting, what we do is that after local anesthesia we harvest a long but thin strip from the donor area or the back of the head of the patient, and then we take that strip and we take that to the microscope and we dissect the strip into the follicular units. These follicular units are then transplanted to the area of baldness. The other technique, which is called FUE or follicular unit extraction, what we do is basically remove one follicular unit directly from the donor area with a small 1 millimeter punch. These little wounds that leave the extractions heal by themselves in approximately 3 to 4 days. Now, the donor area. The donor area is the back of the head where we remove the follicular units. Why do we remove them from that area? Because the hair on the donor area is usually permanent. These hair don't fall and don't suffer the hair loss typical of the androgenetic alopecia. So when we take the hair from the back and put that on the baldness area, the hair keeps growing and keeps the same longevity as of the donor region. Finally, the patient always asks which technique is better, the FUT, the strip harvesting, or the FUE. I have to tell you that the difference between both techniques is basically the way that we use to remove the graft, but the rest of the process, for example the implantation of the grafts or the results, the final result to the patients is basically the same. The only difference is how we remove the graft from the donor area. The FUT will leave a fine thin scar, and the FUE, it heals by themselves those wounds in 3-4 days, so it will leave like little pinpoint scars that will not be visible unless the patient shave completely the head. Another important difference is that the FUT, we don't need to shave the hair to cut the strip, while on the FUE we need to shave almost completely the hair to remove the follicular units with the punch. In conclusion, we tend to choose the technique which is more suitable for the patient, and also it depends also on the patient desires.